Hello and welcome back to In Pursuit of. I'm continuing my conversation with Akriti Gupta, founding member of Win Over Cancer. And she is in pursuit of enabling cancer patients towards a better quality of life. Akriti, tell me, how did you end up starting Win Over Cancer?
It started in 2015 when my father's treatment for cancer started, and he was given just 10% chances of survival. And one thing that we realized is that whenever he used to talk about helping others, he had a different spark in his eyes, and that's how Win Over Cancer was born. I was 17 at that time, just entered my college, and so I was the first volunteer, also a founding member, and eventually, whatever struggles we as a family faced during our journey with cancer, we actually saw every problem as an opportunity. That, if we are facing this problem, others must be too. And we designed a program on that. So it was in 2018 when I went to Tata Institute of Social Sciences in Mumbai to study social entrepreneurship formally. Yeah. And as part of our master's course itself, we had to write a thesis. And the topic that I chose was how the quality of life of a cancer patient is impacted throughout their cancer journey, during diagnosis, during treatment, post-treatment. It was a multi-stakeholder approach. So I interviewed not just cancer patients and survivors, but also doctors, nurses, and a lot of other people. And it's during those interactions I realized that patients who are getting treated in charitable or government hospital, or who are from the marginalized section, it is not just them who are vulnerable, but patients who are getting treated in the private setup, who are willing to pay for these kind of products and services. The need is equally there, the gap is equally there, and the entire ecosystem is willing to support initiatives like that. So that's how Canfem was started.
Of course, in government hospitals and in, semi-government, you could say, like Tata Memorial itself, the number of patients who come is just huge. I also know that the budget in terms of health is very low from the government side. But this is a space that could have been filled by many, and even by the government itself. I'm just curious to understand that, should it be filled by, say, a more like a public-private partnership, or like, since you're a private company, you must be having some thoughts about this.
Yeah. So honestly speaking, right now, the burden of cancer in India is so much. We have about 15 lakh new cases of cancer being diagnosed every year. And that number is growing at the rate of 13% year on year. Earlier, cancer used to be an urban disease. Now, cancer is everywhere. It's literally everywhere. Earlier, cancer treatment was limited to Delhi and Mumbai. Today, we have cancer centers run by government or in a semi-government model across India. The government right now is focusing upon how we can provide cancer treatment to our population. Somewhere or around, that is the starting point, right? The doctors in the hospital, the management, they understand that this kind of support is required. We need to have individual organizations, parallel organizations who are working in partnership with them to help patients improve their quality of life.
Wonderful. So in a hospital like AIIMS, are the doctors totally in sync with you guys?
Yeah, absolutely. Doctors are the backbone of the healthcare system in everywhere, be it public hospitals or be it private hospitals. It is the doctors who actually introduce us to the management, who give us certain permissions. If you're working within the hospital, say we have formal partnerships with Medanta Hospital, where our products, the Canfem products, are available at their pharmacy. So again, it is the doctors who recommended us to the management that, we need this organization's product available in the hospital because they're doing good work and our patients need that. Similarly, in the public hospitals as well, again, it is the doctors whose permission letters work for us, because even in a hospital, you just cannot go and start distributing everything around. There is a formal process to it. Another thing is that here we are not just distributing the prosthetics, we're also collecting certain data for verification. For example, as per CSR norms, we need to have every beneficiary Aadhaar card or election card, basically any ID proof. We need to have their name, we need to have their phone number, we need to have their address, and also as an organization to make sure that these prosthetics are going to the right person, we need to have, say, a copy of any proof that this patient is a patient at the end of the day. There's a lot of trust that goes into this process. It's not easy to get these permissions from big government hospitals and to start working with them, even if you're not charging patients or the hospital a single penny.
I can imagine, they have to know that you're not just somebody who's, coming with substandard products or substandard services, under their name and doing this under their names.
We have to submit reports to these hospitals that, was there any patient who got an allergic reaction because of our product? Or we need to have systems in place that by any chance, because of our product or because of our services, we don't harm the patient.
Right.
Imagine a patient who has just underwent surgery and we give them a bra to wear and a prosthetic to wear. It will harm their wounds.
What is that change you'd like to see in the social sector in India?
Firstly, the perspective of general public towards any organization who's working in a social sector is like, acha, NGO hi hai.
That's true.
Right. Like, for example, a lot of people ask me and my mom who don't know about Canfem, the private limited as well, is, acha, aap NGO karte ho, to aur kya karte ho?
Achha,
A lot of them,
yeah,
a lot of them cannot digest the fact that running a not-for-profit is a full-time job, and it involves money, it involves management, it requires skills, and it's actually equivalent to running any other for-profit business for that matter.
Possibly
It's
even a
actually
bit more
difficult.
stressful and more difficult.
So there is so much of stakeholder management and
so much sensitivity involved, so much convincing of involved. Like, you have to be excellent convincers.
Yes.
There's no force, there's no my gosh.
Yeah, and as a not-for-profit, you cannot make mistakes. Especially today, I mean, if you see the government regulations and especially the FCRA Act coming in, the changes in it coming in, one small mistake can lead to cancellation of an FCRA certificate, or you miss one, you miss to file one particular document and your ATG 12A can be cancelled.
However brave and champion like we are, when we are surrounded by people who are unwell or who are very vulnerable, we ourselves can start feeling really, really low. How do you keep yourself motivated through this?
Firstly, I mean, you have to create a distance. For example, I still remember the first patient we supported ever. In one treatment room, like in one hospital room, my father was getting a treatment, and in the second room, another kid was getting treatment, and we had a few injections in stock that were given to my father. So the doctor requested us that, if you can donate some of your injections, I need urgently for the other patient, and they cannot afford it. So, if you can get some funds and we can help that kid out. And we did. And after a week, that kid passed away. And my mother, she cried so much because, that was the first person we had supported, and that kid did not make it. And, it's that day when my father's oncologist, he just said one thing. He said, if you want to do this, stop working in this field. You have to create a distance. You're not God. You cannot save everyone. A lot of times I get this feedback that when you say the word cancer, sometimes you're not sensitive enough. You say it too mechanically. And I say to them that, this is how I need to just be about it. But
you know what it's like because you've experienced it up front in your family.
Yes.
With your dad.
Yes, yes.
So there's no chance that you're not sensitive about it.
Yes. But, that being said, that no matter how much one-arm distance we try to create, no matter how much, we try to shut our emotions when we are working with patients, still sometimes, when especially when we see a very young cancer patient coming in, these kind of situations do sometimes take a hit on us. But as a team, sometimes we do sit together, and it's actually a ritual. Every quarter we have a meeting, and we share our experiences, how we have impacted a patient.
Nice. Akriti, tell me, what have been some pivotal moments for you?
So, one very big aha moment and the achievement that happened very recently, just 2 weeks back, is when we finally got a patent on our breast prosthetic technology. The patent was pending since 8 years.
Oh
Eight
my
years since we had
goodness.
applied.
Congratulations.
Thank you so much. Then, the second very big pivotal moment was during COVID actually. Before COVID, we could have never imagined women, especially getting connected to us online. But after COVID, that transformation happened. Everyone was online, everyone was comfortable with video chats, with video calls.
Even in a rural setup.
Yeah, having a smartphone and internet became a basic necessity for the child's education.
Right.
Right. So during COVID, definitely it was a very, very stressful time for us. But on the other hand, it's in 2020 itself, in February 2020, that's when we registered Canfem officially. And just imagine after a month, pandemic hit. And healthcare system was collapsing everywhere. Anyone would think that, okay, your organization must have died before it have started, right? But here we made a pivot because in my research, I had identified over 15 issues that cancer patients face during their cancer treatment that are typically non-clinical in nature. We started picking up one issue at a time and we started doing webinars on them. We started doing workshops on them. And we just thought that, okay, I don't know how many people will really join, but we just connected, we just networked with every cancer NGO possible across India, and we said that we are doing this free of cost. No medical terms would be used, and the mode is going to be English Hindi mix, like just general language that we use. And these webinars were a hit. Most of our product ideas or our service
Came from
ideas,
there.
yeah, it came from the community, and that is the reason every product we have launched so far, nothing has failed. Nothing has failed. So, that is how we pivoted during the pandemic. And probably that is why our programs are being accepted in the ecosystem.
That's really wonderful, seizing the moment and seizing the opportunity. So thank you, Akriti. Thank you so much for talking to us and telling us about your journey and about, how Win Over Cancer and Canfem have grown. And I think I'm going to keep it in mind every time, I meet somebody who needs the support. Thank you so much. Keep watching In Pursuit Of. I have just wrapped up a lovely conversation with Akriti Gupta of Win Over Cancer and Canfem. Stay tuned.